expect their teeth to be white and bright after a scaling. Please understand there's a totally different procedure called bleaching to make your teeth whiter and brighter. Dental scaling is a procedure where you professionally clean your teeth in a dental clinic. Everybody needs dental scaling because there is some amount of hard material which is built up on the tooth, which is called tartar. It forms in every mouth because nobody is perfect in brushing your teeth. There is always some dirt left back, even with the best of the toothbrush or the best of the toothpaste, and this hardens and this has to be removed. A good time to remove this is once in 6 months because in that time a reasonable amount of damage happens to the gum which can be reversed very quickly. Now these are the top 5 questions I get from patients who hesitate to come to a dental clinic for getting their cleaning done or their dental procedures done. The first question I was posted is why maybe scaling causes gaps in between teeth. Now the reason why people feel so is because there is already a gap in between your tooth because of the gum residing down, and this gap is filled with this hardened tartar or the calculus. Once that's removed, the gaps are seen and then the myth comes in that there was gap created after doing the dental scaling. The second most common myth I get, or the question as posted, is do my teeth loosen after doing a dental scaling? Teeth normally do not loosen because it's not that easy with just a scaling procedure to loosen up teeth. These teeth are already loose because of the process of gum problems and the supporting bone problem called periodontal problem. This tartar, what is there around the tooth, holds one tooth to the other and actually acts like solid teeth, or they stand well. Once this tartar is removed, already loosened teeth seem to be loose to the patient, so the myth comes in that it's loosened after a dental scaling. The third most common myth that I get is whether there are enamel chipping off or a tooth structure chipping off because of scaling, which rarely happens or probably never happens because a dental scaler cannot remove any tooth structure, or it can't cause much damage beyond removing the dirt around the tooth. The fourth common myth or question that I get is my gums bleeding too much during the dental scaling. Is it damaging? Now, you take this example. A healthy gum is like the skin of an orange, but an unhealthy or a diseased gum is like the skin of a rotten orange. So when you touch an orange with your fingers, nothing oozes out, but when you touch or press the skin of a rotten orange, it starts oozing out liquid. Same happens with your gums. When you do a cleaning, there is a little bit of bleeding happening because the gum is already soft like a sponge. So a little bleeding is okay. Once the tartar is removed, it comes back to health and things become fine. And one more myth that I get, the fifth myth, is that does it increase my sensitivity after scaling? Well, it does to an extent, but again, much of it can be taken care with desensitizing creams. They don't cause much problem. The reason is because once the tartar is removed, the root is exposed, which is very sensitive, and the exposed root is the one which increases the sensitivity, but later it covers up or fills up with the gum and desensitizing agents take care of it. And then the last thing is rather an expectation than a myth, where people expect their teeth to be white and bright after a scaling. Please understand there's a totally different procedure called bleaching to make your teeth whiter and brighter. Scaling does not increase lighten the color of the tooth. It only removes the dirt or the tartar around. It's the procedure of bleaching which actually helps to make the tooth brighter and whiter with time.